Good evening, ladies and gentlemen, and welcome to A Cup of Cold Water. We are so glad that you tuned in tonight. And tonight, we're actually going to be talking about a very, very important topic. If you know anybody in your life, in your whole world, in your neighborhood, who has never had any pain, we want to hear from you. We're going to be talking about pain management and why it's so important. And we have in the studio tonight one of my favorite doctors, a very important man in the community who's done a lot of work around pain management. He's been all over the world discussing how people can control their pain. And tonight I'd like my guest to introduce himself to you. I will tell you this is Dr. Moshe Lewis. Welcome.
Sure, thank you. Thanks for having me.
You're welcome. Thank
so
you.
appreciative to A Cup of Cold Water for inviting me and talking about this topic, which, as you said, is very near and dear to my heart. I am a rehab medicine doctor in sports medicine, so that means that I see a lot of patients who I say are young and have some athletic injuries, but also people who are older and have hurt themselves through either arthritis or just the aging process.
And so where are you working these days, Dr. Lewis?
Right. So I have a practice at California Pacific Medical Center.
California Pacific Medical Center. Okay.
Yeah, in San Francisco.
Oh, wow.
And a private practice near here in Redwood City.
My goodness.
Yeah,
You're
so
a very busy doctor.
That definitely keeps me moving. And then, as you said, I lecture quite a bit on various topics in pain management because it's a very popular topic these days.
It is a very popular topic, and as a matter of fact, I recall that you've done quite a few videos and TV shows on pain management. Is that correct?
Yes, it's true, and I appreciate that. It's something that I think the media is very infatuated with right now because we have a lot of popular figures who have put this into TV shows themselves. We have shows where doctors like Dr. House, who's a fictional character, but he does have issues with pain and taking pain meds. And then we have reality shows that also touch on pain meds and sometimes overuse or the misuse of them. So the media itself has a lot of interest, and part of that is because people are living longer and they are using pain meds a lot more than used to be the case even 50 years ago.
Well, it's interesting that you mentioned House, because House is actually one of my favorite TV shows, even before any of the other ones came on board. And I was very, very surprised. I was so surprised when I saw House reach into his pocket and say that he was taking Vicodin.
Yeah.
And Vicodin was all over the news, people dying from overdoses, abusing prescriptions. Do you want to talk about that a little bit?
No, exactly, you're right. And this is where, you know, life meeting reality and TV really kind of get lines blurry. And you're right, it's not a good example for the public, certainly, to believe that most physicians, because many of them do have access to medications like Vicodin, are being very loosey-goosey about taking it and popping pills. And sometimes, as the show goes, as I'm sure you may have seen some episodes, really going to some extreme lengths. Because people do many times imitate art in their own lives, and we do see that many people are seeing multiple physicians and sometimes getting a hold of medications that are not appropriate. And it definitely has become a problem, so much so that amongst young people, it is a frequent cause of overdose and sometimes death in the emergency room.
And probably the young people are having overdoses because maybe their parents are having to use pain medications.
Exactly. No, you raise a great point, and that's why, you know, we've tried to do so many articles and news episodes about this, because we feel that if young people, like you said, mirror what their parents may be doing, taking these meds, and many times certainly don't need them, it's recreational. They don't know the dosing, they may get carried away. They may mix it with other drugs or alcohol, and then, like you said, that can really lead to dangerous situations.
Of course, we've heard of so many things in the news where women have actually left their children in the car and gone in the house and gone to sleep, and babies in hot cars and dying. And, you know, pain is such a sensitive subject. It is also a subject around many cultural beliefs, both cultural and spiritual. There are a lot of people, you know, I watched my mother suffer in pain, and I would often wonder, and that was before I became a nurse, how come she couldn't find any relief for pain, and much of her pain relief came from alcohol, isopropyl alcohol and wintergreen, and you know, a lot of the home remedies, which really in reality didn't come very close to handling her pain. And so I'm wondering what your thoughts are in terms of the myths that people have about pain, whether they should. I mean, if you're suffering and you're having, we in the medical profession, grade pain on a scale of 1 to 10. So we ask you, how's your pain? Is it a 1? Is it a 5? Is it a 10?
Right.
There's a lot of people walking around with a 10 pain.
Right. No,
but there should be some sort of relief for a 10 pain. But you find that many are just ibuprofen, Tylenol, and we know that doesn't touch chronic pain.
Exactly. No, you raise an excellent point, so much so that is actually coming out on the cover of Time this month.
Really?
The issues related to pain, and we just did an article in San Francisco Chronicle about the undertreatment of pain. Part of the fear that doctors have about prescribing is related to the fact that some of them can't sort out who really should be on these medications and not. And then, like you said, the public themselves, there are many people that have concerns. And certainly, like you said, from a cultural and historical perspective, it was a sign of weakness to go and take these strong pain medications, or the access was an issue. And even today, many people have fears that they're going to get addicted or hooked on the meds.
Absolutely, absolutely. I had a family member call me a few weeks ago, had back surgery, and you know, he said, Yvette, I'm having a lot of pain, you know, and I said, well, you could have the pain and not allow your body to rest, and you're going to continue to have the pain. You need to take the medicine that the doctor's giving you a very long time before you become addicted to it. You know, what you want to do is get rid of the pain, but I don't think most people understand that.
Right, exactly. And so, I mean, part of what I try to promote, and I think everybody who really is practicing pain management, is that relationship, working with a physician over time. We have nurse practitioners now and also physician assistants on a regular basis, and that's something that as I teach other people that are coming up in training, because I'm on staff at UCSF, we want to have people realize that this is going to be maybe a lifelong process. It may be chronic, but even if it's short-lived, we have to work together and see each other monthly. So the patients know that they come in, and it's true, we have to check to make sure they're not seeing other doctors, and we have to check urine and things of that nature to make sure they're taking the medications as prescribed.
Just what you guys prescribe.
Exactly, right.
And what sort of things do you guys prescribe, might I ask?
Yeah, so that's a good point. The industry itself, too, is trying to broaden the amount of medications that are out beyond just opioids. We know that opioids have a very bad stigma. They, as you talked about with Vicodin, can become habit-forming, and OxyContin can become addictive. And so now you see a lot of medications coming out in patch formulation. You see nerve pain types of medications out. So in other words, different classes are starting to emerge because people are living longer and they are getting the types of injuries. They may have a sports-related injury in their 60s. I had a patient today who hurt himself riding a motorcycle, and he was 62. And so as people are living longer and wanting to sort of live out some of their dreams and be more active, they may injure themselves. And opioids aren't always the first thing to reach for.
You know, and that's something that I'd like you to elaborate a little bit about, because many people don't understand that certain medications are prescribed, say, for example, for your blood pressure. But those same meds can also help you with your pain. You want to explain a little bit about how that works?
No, that's a great point, because some of the medications that we use in neurology, and it's true, some of them even in psychiatry, have pain benefits, and sometimes we use a very low dose or very different dose. And this really helps people to decrease their pain without having to be reliant on opioids, which can lead to tolerance and dependence. It's true. The way those medications work, if you take them long enough, it will be very hard to get off of them. So you're right that we have borrowed and found some benefits in other classes of medications that can help people with their pain.
And so how would you approach a patient, for example, when I was a nurse, I still am a nurse, but while I was working at Stanford, Stanford had a program for people that had chronic pain, but these patients were taking, for example, 20, 30, 40 Vicodin a day.
Sure.
And so they went on a sort of a cocktail, and they didn't know what was in it, but what they had to do was contract to say that, okay, I'm going to be able to get out of the bed today. I'm going to be able to go to a meeting. You know a little bit about that. Why don't you tell our audience about that?
Exactly. Well, we're going to take a break.
Okay.
And I'm going to come right back and
All
answer
right,
that question.
we're going to take a break.
Okay.